to do some courses in Bulgaria according to the VieSID concept. And for my person, I'm a dental technician from Germany, and I'm starting with the education of the ideas of Professor Slavicek in the year of 2000. And for me, it was completely crazy to start to learn this, because I have no idea how I ever will be able to educate myself in order to get similar knowledge like Slavicek. And it took me more than 10 years to understand a little bit about the whole concept. And then for me, the best thing was just to start doing lectures, but the possibility to do lectures and try to educate people helps me a lot to understand the whole concept much more than before. And till today, I think that I improve every year more and more, only due to the situation that I have to think about the idea. And this helps me a lot. And it would be a pleasure for me to show other people, for example, in Bulgaria, what we think about dentistry and how we can transfer the ideas of Slavicek to the mouth of our patients. For me, it's a big helper in daily business. And I'm quite sure that it makes me more successful than before.
I want to add something. We don't collaborate only in the VieSID in Bulgaria. We also collaborate in VieSID in Brazil, also with Dani.
Yes.
And we had a great time with the international courses there, and the whole experience giving the course in Brazil and the whole energy that we have there.
This was really, really great.
Yeah.
And for me, it's not only Brasilia. I'm working all over the world for the VieSID. And I have a big experience of different kind of nations. And at the end, for me, the world is becoming very, very small, because the problems all over the world are always the same. And this is for me a big advantage, because I learned to love other countries. Yeah. And for me, the world becomes much smaller.
I want to ask you a quick question. You've been a dental technician before you met Professor Slavicek. And
yes.
What is actually the difference before you start learning the concept and applying, and after that? Just if you can.
I just will show some slides about it. Yeah. The basic reason why I was starting to learn the concept was that I was unsatisfied with the way of my daily business working, because when I'm starting my own business in Germany, I'm only doing aesthetic cases, and I was happy because I was young to make a nice smile, but very, very often I was disappointed after a certain time, because the patients are not able to adapt to the new occlusion that we are giving them. And the result was that they're just destroying it. And if patients are destroying our occlusion, then I have a problem, because I'm a businessman. And when they are not satisfied, then I have no possibility to do more work for this kind of dentist. Yeah. And so I have to find a solution for this problem. And since I'm working more and more on the Slavicek concept, the quality of our work is improving, and the rate of mis-success is coming on a lower level. And this makes me and my patients happy. And that's the reason why I am satisfied with this concept. And for me, it's very important that I'm not a professional teacher. I'm just a colleague of you. And what I'm doing in the VieSID concept is just share experiences, and not someone from the university who has no idea what happens in daily business. I'm every day at the bench, and I have to do work that is running in the mouth of the patient. Yeah. Otherwise, they will kill me.
And yeah, you're from Stuttgart, and the demand there, it's very high, right?
Yes, that the people are used to get high quality. It doesn't matter if it's in dentistry or in other kind of points of life. for example, when they are buying cars, they would like to get a nice car. All of you know the brands of Mercedes or Porsche.
Yeah.
And the people here, they have the money for buy these. But when they buy these, they're not accepting fault. And this is the problem in my area, but at the same time, it's an advantage because they are able to achieve our work. Because when we spend more time in our work, it doesn't matter if it's dentistry or dental technology, we have to charge more money, and it's an advantage to have customers or patients who are able to pay our work.
That's true. It is true. And actually, when you give more time and when you dedicate the precision in the work, you actually give the long lasting of the work, right?
Yes.
Yeah.
And then I think this is something very, very important because it's one thing to be expensive, and it's another thing to give the patient a work or a result of your work that will last in the mouth of the patient for 20, 25, 30 years.
Yeah.
And I tell every patient that for sure, when we're doing a full mouth reconstruction, there could be some problem on some single teeth, but there never will be a problem for all the 28 units. It's and this is a big advantage for us.
Yeah. Okay. If you I think you share your screen right now, and maybe
I just will.
We can see the presentation. Okay.
Here we are. You can see everything?
I think so, yeah.
Okay, perfect. I don't know what these two green scratches are here, but it doesn't matter.
Those are from the annotate and from the line. Maybe you draw something, but don't worry about them.
Don't know. I just would like to show you some quick pictures to get an idea what we try to do inside of our courses. And I first would like to, what's happened here? Sorry.
You put the annotate, maybe just, let me see. 1 second, can you go down? No? Yeah. I am,
okay.
Yeah. Okay, good. I think it's working.
Okay, now it's working.
Yeah.
I just would like to give you a quick information how we can transfer the idea of Slavicek in the mouth of our patient. And for me, this is something very important, that we are learning an idea or a strategy that helps us in every single case of our patient. And it's not based on a certain way of occlusion. It's based on the problems of the patient. And this is, for me, the biggest advantage of the Slavicek concept, that we are not only thinking about patients in a class 1. We just try to give the patient an occlusion that fits to the necessities of their problem. We are not adapting the patient to our occlusion. It's just the other way around. And this is a big advantage. And I'm doing this in my laboratory. This is the name of my laboratory since 23 years. And I'm quite sure that Slavicek gives me a very, very important hint, kick in my ass, how I can improve my daily work. And very often we are blamed that people out in Slavicek concept are only doing 28 unit cases. But this is completely shit. We are just trying to understand the problem of the patient. And in a lot of cases, I'm not doing 28 units. I'm only doing the thing that is necessary for the needs of the patient. And this is a big advantage for me. And I'm very, very thankful for Slavicek that he opened my mind to think in a deeper way about dentistry than in the way I did it before. I learned a lot about aesthetics and very nice things. But at the end, aesthetics is only one small part in our business, and it's necessary to combine function and aesthetic at the same time. And especially in our market, it's very, very often not accepted that we are we are not only thinking about function. When you're thinking just the last 20 years back, all the young dentists, they're completely crazy about layering techniques, about shapes, about surfaces. But very often they realize after a certain time that this is not everything, and it could not solve all the problems of our patients. And very, very often I had patients where I solved the aesthetic problem, but after a short time, the problem was occurring again because I'm not trying to understand the basic problem of the patient.
Yeah.
Of course, the patients are complaining about aesthetics, but it's our task to explain the patient that the aesthetic is at the end very important.
Yeah.
But we have to find the key. We have to find the reason why the aesthetic is destroyed by the patient.
Yeah, actually, I would like to add something here. As we know, the cybernetic circle from Professor Rudolf Slavicek, actually, aesthetic is part of the function, and we have to cover 7 components as mastication, swallowing, speech, stress management, and also in the end, we have to combine everything in aesthetic way. So aesthetic is part of the complete game. It's not just aesthetic or function. It's always both, and they're part of it. So we have to think about that as a part. Yeah,
I'm absolutely with you. And in my opinion is that the aesthetic is the result of the function. If you're not doing this in this way, we will create an aesthetic that will not last in the mouth of the patient. And what we are talking about an occlusal concept. And for me, I learned a lot of different kind of occlusal concepts from different professors all over the world. And at the end, all these concepts were ideas of some professors. And the big difference between other concepts, or Rudolf Slavicek's concept, is that he just tried to copy the function of the nature. He was observing a lot of natural skulls, and the result of all these studies was the concept. So we're not trying to understand, or we're not trying to create something new. We're just doing what nature was developing. And this is a big advantage. We are accepting growth.
Yeah.
And for me as a technician, it's a very, very big advantage that we are not only thinking in a class 1. And when you compare these to other kinds of dental concepts, most of the dental concepts only have solutions for class 1 patients. But class 1 patients are not the average. It's only a small part. And even when we do have a class 1 patient, this does not mean that the class 1 patient will have a perfect function. And for me in my daily business in laboratory, I only have to learn the basic concept of Rudi, and I could adapt it to every kind of different occlusions. And for me, malocclusion is not existing. We do have occlusions which are a little bit better or a little bit worse, but it's not mal. And it's our task to give the patient an occlusion that is adapting as good as possible to the situation of the patient.
Yeah.
And just as an example, this was a patient we did a long time ago, and he was in the age of 21, 22, and he was only asking about aesthetics. And I can understand the idea that this patient would like to have a completely different aesthetics. But we first have to understand the problem of this patient. And the advantage for me, when we understand the reason why this patient looks like he looks, we could give him an aesthetics like this, but in combination with a good function. This is only a picture of the aesthetics. We could not see what's behind the frontal teeth, but it's very, very important to give these patients a whole system that avoids that they will kill our work. And this is for me something very, very important. If you're not respecting these, the patient will brush these teeth in the same way like the situation it was before. And all of us, we know cases like this, and all of us know that we are not successful, even if we change the material to a more rigid material. The patient will have the same habit like before, and without improvement in function, he will kill it.
Yeah, sure.
Same on this patient. I like this patient very, very much because it's a patient where you can see a lot of problems inside of the occlusion, and with the idea of Professor Slavicek, we can transfer this patient to this, and it's not only an aesthetic case; it's a case where we improve the function a lot, and we have a guarantee. We have a guarantee when we are working on a very clear, precise, and strict way that this work will last in the mouth of the patient for a very, very long time. And this is for me the key for success, because I'm paid for successful work and not for work that looks beautiful. Of course, it must be nice, but at the end, we have to understand the reasons behind why the work is running. And when you have a look at this kind of waxing, it's waxing of a patient. It's dental class 3, and I just would like to give you an idea during the courses to understand this language of the waxing. All you can see here on this waxing with the different colors, you will immediately understand the functional ideas which are transferred to the occlusal surfaces. And you will understand the problems of this occlusion. And this helps you during preparation, during planning, during the whole planning of the work. And I like to have it very, very much, to have a clear, strict plan before we are starting with the work. Everything is clear to the patient what to do. It's clear what will be the price, and so on.
Yeah.
Manuel?
Yeah. I can add one thing here, that when the patient comes to us, they want aesthetics, but in presume they also want to be able to chew with these teeth, and they don't want to come many times to our office to redo the work. And actually, for me, sometimes being a little bit more aggressive and giving more, let's say, for example, occlusal support in a long run, this is a minimal invasive dentistry, because most of the time minimal invasive dentistry is not connected with reducing less teeth, but reducing the appointments in the future that patient will come for redoing the broken restoration, for example.
Yes. And what I have to add, that the quality of my patients during the last 20 years changing dramatically. In former times, I had not very often patient with a very strict and clear pathologic situation. They don't have a lot of pain.
Yeah.
And nowadays in my laboratory, at least 80% of my patients have a very clear and long pain history behind them. And for me, this is a very big advantage, because if patients have pain, it's a perfect possibility to earn money at the end of the day, because when you can give them a clear idea what you will do during the treatment, and if you could prove this, for example, with a splint therapy, and the patient is during the splint therapy without pain, then the risk that the patient is not believing you is on a very low level. And trusting to the dentist is very important. And a lot of my patients, they have 3, 4, 5 full mouth reconstruction before, but the result was always the same. Perhaps they look nice, but the pain is still there. And the reason is that most of the dentists, they don't take care about the reason of the pain. because they have no idea how pain is created.
Yeah.
And for me, something completely new was that I have to change my mindset. I have to change my thinking about occlusion. And nowadays, the relationship between the condyle and the different parts of the occlusion, it's very, very important. And when we don't understand the relationship between these two parts of the occlusion, then we have no chance to give a patient a new occlusion that is really healthy for the patient.
Yeah.
And what also was very new for me is that we have to think in dynamic. Dynamic is something which is every day happening a lot of times. And most of the technicians and of the dentists, they are only thinking in a static position.
Let me
Most of
add
the
something
dentists,
here. It's not
yes,
only happening in the day, it's also happening in the night.
of
And
course, yes.
if we think about the total amount of time that we are chewing, it's around maybe 30 to 40 minutes. And actually, most of that chewing process, the food is not, it's not allowing the teeth to touch to have the teeth contact. And most of the time we are chewing with the tongue on the palate because we are eating too much processed food, like. And
Yes.
the bruxing time, it's more or less between 1 hour and 3 hours and a half, and we have complete teeth contact and a lot of forces there. So we need to know the day and the night static and dynamic occlusion.
And this was for me as a technician something, it was not completely new, but most of the time I'm not thinking about dynamics. Today, I'm thinking much more about dynamics, and static is important for stabilization of the teeth, but dynamics, it's necessary for daily life.
Yeah.
And this was new for me. And to be able to transfer these dynamic to the mouth of the patient, we're just using an articulator that we could adjust as much as possible to the movement possibilities of the patient. And to have an idea about the real movement of the patient, we do have the condylography. And this is just one example of one movement. This is protrusion and retrusion of the patient. And I just would like to give you the chance to learn in the courses to understand the curve. This is not only a green line. Behind this green line, there's a story. And we have to understand this story in order to produce exactly the right occlusal surface with the right movement possibilities. And when we understand this, then we can do a real good occlusion for the patient.
Yeah. Yeah.
And for example, when you have a look at this curve, you could see over there, this part, it's a top view of the head from this direction. And this patient is going strongly during protrusive and retrusive movement to inside. And when you just try to imagine what happens during this protrusive and retrusive movement, the patient is going in this direction for 2 millimeters. And when I have a look at this picture, I know exactly that the patient must have pain.
Yeah.
Because he's doing a lot of muscle effort during every single stupid protrusive movement, 1,000 times a day.
Yeah.
And the possibility to detect this and not have only an idea that there could be a problem, just to see it, this is a big advantage for me.
Yeah, and let me add something here, and this is really hard to explain, but as we said, that we need to analyze and see the occlusion in static and in dynamic during the day and during the night. Also, we see here the left and right joints from the 3 dimension, from the coronal, from the sagittal, from frontal, and this is very important because we can see the problem from each angle and also treat the left and the right joint separated as there are 2 different patients. Because in my practice, I do in every case condylography and at the beginning. And I never see a case where the left joint is exactly the same as the right joint. So for me, this is another door that it's open, so we can really, really try to individualize the treatment and the restoration to the patient needs.
And this is for me a very, very hard task in daily business.
Yeah.
Because it's necessary to first we have to understand the problems of the patient. This is, for example, also a very good helper. This is the product of a lateral set,
Yeah.
and all these numbers are very important for my daily business. And it's important to understand this for yourself in order to transfer your treatment idea to the patient.
Let me provoke you here with a question. I'm sorry. So
Yes.
are you really saying that you need the CEF, the cephalometric analysis in your lab work?
Yes, I do.
How come
Because
this is not an orthodontic X-ray?
It is an orthodontic X-ray, of course, but I do have the advantage that I understand these numbers, not all of them, but the numbers which are important for me. And very often I'm working with dentists who are educated by a Slavicek, but not all of them have the really deep idea of everything. And I think it's a perfect possibility to develop together a treatment plan. Together means dentist, orthodontics, technician, and all the other parts of dentistry. And when we could sit together on one table and talk about one patient and find together a solution for this patient, it will be the best possibility for our patients to find a really good solution. Because the problem is that everybody of us, we will have our glasses. My glasses are the glasses of technician. You are the glasses of a dentist. Another one who is doing only implantology, he is only thinking in this kind of screws. And an orthodontic is only thinking in orthodontics.
Yep.
And the best solution will be a combination of the best of all different subjects.
Yep.
And it helps a lot if technician knows a lot about dental work, and if the dentist knows a lot about technician work, and also orthodontics and so on. And this is for me a big advantage that we are able to collaborate together, and especially the software we are using. It's a perfect communication tool because we could talk in different countries together about one single patient and just put in our ideas to find a solution for this patient. And therefore, it's necessary for me to have this sheet of paper.
Yeah.
I would like to have it.
Yeah.
Okay. And the big advantage for me, you can see here a very small class 1. And we are using exactly the same functional ideas in different classes. This is, for example, a class 2. It looks completely different kind of case, upper jaw, upper part of the frontal area is not prepared. But we are always using the same functional pattern. Only the location of the function is different. This is the class 3 case, but it's a mixture between class 3 and class 1. And the advantage in laboratory, we don't have to learn a lot of different kind of knowledge for different dental classes. We're just using the same weapons, and the function will happen in different parts of the occlusion. And this is a big advantage for me.
So just to summarize here one thing, so it's very important to point that we have different approaches in the different classes. Class 1, we approach the wax-up in one way. Class 2, we approach in another way. Class 3, we approach in another way. And we are trying to give the patient the final goal is to give the patient stable occlusion in static and dynamic, but the approach is different, right?
Completely, the approach is different, but the weapons for the approach is always the same.
Yeah.
And just as a small example, when you have a look at this tooth number 3, on the palatal surface of these upper tooth number 3, we have different small pathways. The red points are the centric occlusion, and the other green and blue pathways are for lateral occlusion, protrusion, or retrusion. It's 3 different kind of functions on one single tooth. But this is only due to the situation of this patient. And we are able to give the patient a guidance system that fits as good as possible to the position of the teeth of the patient. And this is, I think this is a very good and clever idea to find solutions for our patients. Something very important also, Bruck's checkers. Bruck's checker is it's a very small device. It's quick to be done, and you could see a lot of functional patterns during the night. For example, this is the Bruck's checker. It's worked by the patient during the night, and for me, it's important to educate my students to be able to read this Bruck's checker, and it's necessary to know more about occlusion in order to understand all these scratches, the white marks on the surface of the Bruck's checker. And this is not so easy because you have to learn more and think more about dynamics and about occlusion in order to transfer the same patient over a long period of treatment to the result, like you can see here. This was the patient before, and this is after. And you could see, even if you understand not a lot about these things at the moment, but the balanced contact during dynamics are nearly away. Only in the area where we planned it. And this is a proof of the quality of our occlusion that we inserted in the mouth of the patient. And I like it very much if a plan at the end is running in a good way.
And this is a tool to do even the checkups of the full mouth re-up every year. So we will, because when we finish a case, that doesn't mean that the patient will be always in the same position. We are getting old, things are changing in our body. So this is a really great tool to check what exactly is happening with our work, not only pictures, not only articulator paper, but just to see what's happening when the patient is sleeping. And for me, this is a golden standard to check my work after I finish it every year when the patient comes to my practice.
And this is not sophisticated and it's not expensive. It's just to control our own work and perhaps to prepare the patient to some risks that are occurring during lifetime, occurring during the time where the patient is just wearing the new occlusion. After 10 years, perhaps we have to do some changes inside because the life is changed of the patient. But the basic plan that we are adapting on the occlusion is that we plan abrasion inside of our occlusion. And this is the idea of the sequential occlusion. So we are not doing an occlusion for today. We are trying to do an occlusion for tomorrow and for the next 10 and 20 years. And this is too complicated to explain this within half an hour. But if you would like, we can do this. This is the same patient just before treatment. And on this patient, we are doing a lot of pre-treatment by orthodontics, by prosthodontics, and so on. And at the end, the patient looks like this after 1.5, 2 years. But the big advantage for me, this patient is the same like on the Bruck's checker. He is not para-functioning in a way that is unhealthy for the patient. And this is good for periodontical situation. This is good for the survival chance of every single unit of this occlusion. And this is a good idea. And therefore, I like to talk about this. And I like to transfer and spread the ideas of Slavicek.
thank you, and
you-
yeah, thank you very much for this great introduction of what we are going to discuss, what we are going to learn, and a very, very small part of everything that we are doing here in Bulgaria. I want to see if somebody has some questions, maybe the people from here in Zoom. If you have some questions, please put it in the chat. We will give like maybe 60 seconds to wait for the questions, and maybe the people from Instagram, if somebody has some question, they can write it. I don't know. And yeah, I will use this little time to say thank you, and thank you for the time that you spent with us today. I know that it's your relaxing afternoon, and yeah.
I am relaxing.
Yeah, is this beer? Okay.
This
Great.
is beer.
Yeah, that's great. Let me see if we have some questions. I don't think we have any questions. Maybe another 30 seconds if somebody asks something. Most of the time, people are sending me messages after the Zoom, so feel free to ask me questions, and later we can I can answer. So yeah, from Instagram.
It was a pleasure for me to join you,
Yeah.
even on Sunday evening. And I hope that we will meet in Sofia or
Yep.
somewhere else on this world.
Yeah, we will meet each
that
other.
world is very small.
Maybe we will meet in a few weeks in the summer school. Are
In
you going to
Vienna?
be there? Yeah.
Yes, I'm
So
going to summer school.
yeah, we are going to meet each other. So yeah,
Great.
I think that's it for today. Thank you, Stefan, and we keep in touch, and take care. Thank you for your
Thank you very much, Manuel.
yes. Bye bye.
See you and
Bye.
see all of you. Bye bye.